So if you've ever dealt with pain, physical pain, you know it is not fun. And if you've been in chronic pain, you know that's a whole other deal. I have been there myself. I know it well. And you can see me tapping because we're going to be talking about how EFT tapping can be very useful in ways that might be surprising. That's the main point of this conversation, is to really reveal not just anecdotes, but solid research happening. And we're really lucky to have Celina Tonkin with us to share and explain a lot of this. So thanks, Celina, for joining us.
Absolute pleasure, Evan. Thanks for having me. And hi, everyone who is watching.
Yeah, and Celina is a trainer at EFT Universe where I studied, and we got to interact in person not too long ago, which was really awesome. And Celina, I know you have a lot that you want to kind of cover and share about why it's important to get the word out about tapping specifically for pain and chronic pain, and that it actually can be helpful. And this is a conversation that we were just saying before is not had as often. And there's sometimes resistance to talking about it, both as practitioners and clients, and maybe just lack of awareness of some of the research and understanding of how it can actually be helpful. So how would you like to introduce this to us?
Yeah, good point, Evan. So we generally don't talk much about how helpful and powerful EFT is when we are dealing with acute pain, chronic pain, or diseases like cancer and other things. Why am I personally so passionate about it? Is because I have at the very beginning of my career as an EFT practitioner, I applied it on myself, and I'll use the word cured for myself. I cured myself from debilitating migraines. So prior to applying EFT on myself, I was hospitalized 3 times. And then inside of like 6-7 hours of tapping over a couple of weeks, I stopped having migraines. And after that experience, I became a believer. When you experience something on yourself, there's nothing more powerful. And then for a while there, I worked with clients who had migraines, and the success rate was amazing. So when someone has a migraine, and it's often those type of headaches are caused by stress, and there's no structural issue underneath, then the success rate is amazing. Now, as a practitioner, EFT practitioner, of course, I first have to ask if they have seen the doctor and what the doctor says about it. And for them to tell the doctor that, we are doing the EFT for whatever they're dealing with, physical issue. So I don't diagnose, or I don't say that I cure. But I also participated in the EFT and chronic pain trial, which was done here by Dr. Peta Stapleton at Bond University. And the results of the trial also show how powerful EFT is with reduction or even eliminating of that chronic pain. And that is one of the reasons, because I can see we know the impact of those issues in our life. It's not just that we are dealing with pain. The impact is on every area of our life. So with EFT, we can help with the actual pain, but we can also help with the lifestyle issues around the problem. And I have noticed, and you might have noticed similar thing, that people are open to work with EFT and maybe business issues and EFT and maybe money issues and things like that. But as human beings, maybe we're a bit more skeptical, and it seems like more challenging to think that it can actually help me with such an important issue like chronic pain, acute pain, or even things like, things that I'm dealing with as a cancer patient, possibly. And what I mean by that, let me just clarify what I mean by that is, once again, I know from my own experience how helpful it is with, for example, chemotherapy. And I have been in hospitals and helped clients to tap through the chemotherapy. And I have seen how helpful it is. There's also research about, EFT and cancer done at some hospitals. So that's the motivation behind why I'm so motivated to have this conversation and spread the word around EFT. Now, Dr. Dawson Church, Dr. Peter Stapleton are doing amazing research. And we can actually put link to some of that research under the video. Yeah.
Great. Yeah, I feel the fact that there is research and giving a little bit of context and understanding of what EFT is actually doing and why it could be beneficial for pain with the context of how it sends signals to the brain and the whole process behind it, I think really can help with some of that apprehension around using it for things like pain. Because part of my theory with things like this is that EFT does straddle often into that world of pretty like light, like spirituality light, where it's like, oh, just attract abundance and these very sort of abstract terms. And you see a lot of EFT in that space, right? It's not like EMDR where you have to be a licensed therapist to do it. So EFT in a lot of people's minds, in my experience, is kind of like it's in that magical world, right? It's like, oh, it's this thing I do, and I visualize like my perfect partner, and that's what it is. And understanding what's actually happening and why it works, and that there is research to support it, and that the research shows that these points actually matter. Like there's a difference whether you just kind of tap random points versus these points, and that when you're sending a calming signal to the body while you're experiencing something like pain and sending a calming signal to your brain, there is a lot of research that I think people are becoming more familiar with in terms of mind-body relationship. Even a lot of the advertisements you're probably seeing right now, if you're here on YouTube, have these things like, how the brain is so responsible for pain, even if there are structural things happening in the body, right? The signals coming from the brain, and then understanding that EFT actually directly involves that, it starts to make a lot more sense to people. So maybe we can take it in that direction a little bit as far as to why on a, it doesn't have to be super deep, but why on a realistic sort of scientific level, tapping on these points and focusing on your physical pain and talking about it can actually make a difference and not just be a positive thinking type of experience.
Yes, you said a lot, Evan. So there's so many things, we can talk about in what you said. But let's start with the actual trial on the EFT and chronic pain. So the trial shows that the participants had positive outcomes, not only with the subjective, testing, and not only with the anxiety, not only with the tension, not only with the depression, surrounding the chronic pain, but studies also show that there were actual changes in the brain.
Mm.
So there were fMRI studies done on the participants. 22 participants had fMRI studies, scans on their brain before and then after the trial. And it showed that area of the brain where we have the catastrophizing thinking, magnifying thinking, around the pain, that area can grow if we don't know how to deal with that area. But with the tapping, actually 6 weeks of tapping, that area shrinks, stops lightening up, and might even disappear over time. So with EFT, we can actually rewire the brain when it comes to chronic pain. And the brain can start operating like the person with not chronic pain processes the pain. What I mean by that is we need pain to alert us if we are in danger, yeah? But the brain will send us signals. But if we don't know how to deal with that, we can get stuck in that vicious cycle of suffering around the pain, the anxiety, the tension, the fear, the projections. So EFT can help with all of that. Now, so the studies show that, Now, when we talk about pain, we often hear the word stress. Stress can cause chronic pain. Stress can cause, there's research that shows stress can cause, there's connection between stress and cancer, especially childhood stress, and developing cancer in later life. So stress, toxic stress, we hear that often. EFT is very powerful with decreasing that stress level. So I can go on and maybe, I'll just finish. I'll just mention that with 1 hour of tapping, the research shows that in 1 hour of tapping, we can actually decrease that cortisol level that causes the stress by 25%. So that is a powerful reduction of that hormone that, creates erodes our internal organs and our muscles.
Great. And I think it'll be important for people to know when you say tapping or 6 weeks of tapping, right? What specifically, for example, are we just literally tapping and not saying anything? Are they tapping and doing something where they're following a script or watching a video and just focusing on the symptoms, focusing on something else? Or are they working with someone more in the style that we might do where we're asking questions and taking it to deeper places and memories and things of that nature?
Well, let me just quickly explain that, how the tapping, just give some explanation of how tapping works,
Great.
what we know so far, yeah? So people will often say, that they're scared to tap because we tap on those acupoints and we say statements that cause stress for us. Like the statements could be limiting beliefs. The statements could be, like a feeling, distressing feeling. The statement can be something about tension in my body. And people think that if we repeat those statements, we will actually hardwire them, keep hardwiring them in the brain and make things worse, But in fact, we tap on the acupoints. And like you said, it has to be the acupoints. It's not other points. It's not the shame points. They will not produce results. You need to know where the acupoints are. So we tap on those points long enough to send that electrical signal to the brain where the stress is, to release that stress. So that's why we need to tap on the truth with what we are dealing with right now and right here. We don't ignore it. We don't suppress it. we deal with that. That's why it's so powerful. So then in the 6-week trial, we would tap on issues like, first of all, you can also tap if you have any doubts that EFT can help you, or that the EFT can help you with this issue. You can tap on that to resolve the doubt.
Mm-hmm.
You can tap on, say, the way you feel, the anger you feel around how the medical profession treats you if you have a chronic pain and they don't believe you. People also they might want at the beginning, they might want to know how the experience, the reduction of the intensity of the pain. So people that increases the trust that the EFT will work. Yeah. So then we might work on ask questions like, when did you first experience these symptoms? Because research shows that it's often 12 months to 18 months or 2 years before the symptoms start that there has been could have been an adverse accident or stress in your life. So then we might actually tap with that, the feelings around the accident or the divorce, the feelings of anger and fear that contribute to the stress and contribute to the pain. So we will tap on that. Very important aspect is insomnia.
Mm.
And, when we tap on insomnia, we can actually help people to restore their physical body through the night and deal better with what they need to deal with, the practical aspects of life during the day. So those are some of the things that we tapped during the trial. And the way we did it was there was a facilitator for each session with a bit of talk on the issues that we are dealing with and the tapping we're going to do that day. And then participants would go into breakout rooms and tap with the emotional assistants. So it wasn't actually tapping with a script. This is the powerful thing with EFT. When we see people on YouTube, you see them tapping on, with a script. But and that is helpful, and it will not hurt you, but it's not sustainable. But we as an EFT practitioner, and you have experienced this, we can work with what the client presents for us right then and right there. And that is why so powerful. It's not one size fits all. Yeah.
Yeah, it's very useful for people to understand that because, as you know, everyone gets a lot of information right now with the internet, YouTube, where we are here. You will hear things like it's really important to think positive and saying negative statements, whether that's like in a context of people talking about mind body in a little bit more of a scientific approach, or more spiritual type videos. People like, oh, if you think about a negative thing or say it, you're going to make it worse. And it can make people pretty conflicted about, okay, so what do I actually do? And why is something working? But understanding that when you're tapping and vocalizing and expressing what's actually stressing you, that's very different than complaining, right? It's not the same thing as just saying, oh God, this sucks, this pain sucks, when am I going to be out of this pain? If you're just thinking that and stewing on it and ruminating on it, you're doing it while doing something that sends a contrary physical experience, which is very primal. It's very direct, right into the body, right? It's somatic. So your mind can be saying like, this sucks, I hate this, when is it going to end? And literally just the fact that you're doing this makes it a very different context than if I'm just sitting in my bed going, this sucks, this sucks, this sucks. Adding this component is actually giving an element of treatment. You're actually doing something, and you're actually encouraging yourself to get it out and help it move through and help it be actually validated, which is important, like you said, because a lot of people with chronic pain don't feel validated, and they don't feel that people really understand, maybe they literally can't understand what it's actually like. And so there's this element of needing to have your own feelings validated and heard. And of course, if you're working with someone in an EFT setting, they will also be validating. And that's one of the things that's useful about EFT, right? You're not going to say in an EFT session, oh, well, let's not talk about that because that's negative and we need to be focusing on the positive. That's like the worst thing you can say to someone who's been sort of gaslit about their experience. So you have somebody coming, or you yourself are experiencing chronic pain, you're going to be experiencing, okay, yes, I'm taking everything you say to me as a chronic pain person or acute pain person in an EFT context. I'm taking what you say seriously. I'm acknowledging it. I'm validating it, often repeating it back to you and expressing the emotion while doing something that also helps it process through. So when people can have a context for what is being accomplished and why it's being done the way it's done, it can help reconcile any conflict. Like, well, is it okay to do this because positive thinking is supposedly better for my symptoms? Like, this is a very specific thing that you're doing, and it's creating a very specific environment where it's totally fine and encouraged to get all those feelings out and say all those frustrations and the fact that you don't feel seen, heard, and validated. It's actually important to do this, and whether you use tapping or not, but I would recommend doing it because it's accessible, right? And even if you can mention later, I think you said that not, I think we've said privately that even if people physically can't tap, you can visualize the tapping, you can do other things that help facilitate this so that you have this really, really important component of working through the emotional stress, the feelings that you're feeling, right? You cannot just beat yourself up to try to think positive. And you hear these things like, well, your brain contributes to pain. And then I've had conversations with people where now that's a source of stress because I'm stressed that my
That's
stress
right.
is making my pain worse. And
That's
it's like,
right.
now I can't even think right. And so
That's
this
right. And
element
you
is really,
start make
really
yourself wrong for actually causing the stress,
right.
but you don't know how to stop the process. Yeah. So the idea is not like just to tell, the story of the pain, because when we keep repeating the same story, like I feel bad and I don't feel hurt, but we just say it, we increase the stress level in our body. We increase the cortisol level in our body. We distress further our body. But if we say the truth, what I'm dealing with right now, and I want you to hear me, and you are hearing me, I don't feel good. I feel upset. I feel scared. I feel scared about the cancer coming back, the common fear, with people who are dealing with cancer. If you say that, but at the same time, you are actually tapping, you are saying something that it's unpleasant or scary, but you are decreasing the cortisol level in the body and increasing the feel-good chemicals. So then you counter condition, your response to your distress, be that emotional or physical or mental. Yeah. And that's why it's so powerful. But also, studies have shown that it's not only the counter conditioning, so it has that thought transformation or change, but also it has biological impact on your body. Like we said, the cortisol level, that the adrenaline, the hormones that cause the stress, they decrease. Studies show that in 1 hour of tapping, you can impact 72 of your genes. You can upregulate and downregulate, in a good way, 72 of your genes, including you can have impact on the cancer suppression gene. So you have this, what we call cognitive shifts, when you have those aha moments, like, wow, now you might make the connection why you feel this chronic pain with something that happened in your past. You have that, but you also have those biological changes in your body. And so the heart variability rate will change, the blood pressure will change. The scans show that the tension of your muscle, is it ECEGM or something, the tension of the muscle releases. So how do we increase pain in our body? One way, it's by tensing. So when you can then tap and relax those muscles, you physically decrease that pain in your body. So EFT utilizes that mind-body connection in a very powerful way.
Yeah, it sounds like it literally impacts the physical structure as well in terms of the actual muscle relaxation, as well as the therapeutic component of lowering the stress, getting a chance to speak your feelings, have them be validated. So
yeah.
It's really hitting on a lot of different levels. And so if someone is intrigued by this and they want to, start experiencing this, what's one path forward? Is it going right into working with a practitioner? Any things they can try by themselves, or what would you suggest?
Look, you can try things by yourself, but chronic pain, diseases, they're very challenging. This is the time. If you need to be vulnerable, this is the time to be vulnerable.
Yeah.
And to let go of the skepticism and work with someone who is a trained EFT practitioner. Because they will support you, they will hear what your needs are, and will educate you and support you how to attend to all those aspects, of the issue that you are dealing with. Like I said, with cancer, one of the problems with chemotherapy is the side effects of the chemotherapy. Mm-hmm. And you can actually help yourself, to tap through that chemo session to decrease the tension in your body, to decrease the fear in your body, and hence experience less side effects or not even experience any side effects, So, but yes, when you're dealing with those issues, it's the best to go and talk with a trained EFT practitioner.
Great. Have there been either studies or things in your experience that show group sessions are helpful?
Well, for example, the trials, they often are done in group sessions. And also I have done group sessions with cravings. I have a closed group right now that's face-to-face group session. And it works on so many levels, working in a group session. Yes, there are some cases where you would like to have individual session and discuss the issues individually. Mm-hmm. But the group session works on, many levels. One of them is that you might be sitting in the group. And so when we deal with such serious issues like pain, we might actually go into denial. We might, be scared to think about certain things that stress us in our life. And so you can't actually resolve them by yourself. You can't see them, clearly by yourself. But when you hear someone else tapping on certain issues, saying like, I'm ashamed to tell people how often I feel this pain, I'm ashamed to tell the doctors that what they recommended didn't help. And you hear someone else saying that you feel as a human being a permission, you give yourself permission to actually get in touch with that shame as well, and then voice it and then feel validated. The other, it's like, it's this concept of mirror neurons. You can read a bit more about that. But also with EFT, we have this unique thing that's to EFT, which is borrowed benefits. So if I work with someone at the front of the group with one person only in the group, work on their issues, the other participants, they can rate the issue they're dealing with, then they can put their issue on side, tap with the what the person at the front of the room is tapping with, and not even think about the issue, while they're tapping with that person. And their stress level will go down after the few rounds of tapping. And that's called borrowed benefits. So that is the benefits of working in groups. And I think for many issues, this is my personal view, that for many issues, actually it helps more to work in a group. We are, social beings. We recover in community. We live in we used to live in tribes.
Yeah.
So groups are very powerful. So if you feel a bit like scared, concerned, joining the group, talking about yourself, chances are many people in that group will feel the same to start with. But as you develop the trust inside of the group, you will feel more open to be vulnerable.
Yeah,
what you're dealing with. Yeah.
I'm a big fan of the group settings, and have noticed, when I do them pretty consistently, and sometimes there are people who they never speak up, but they come consistently, because when they still get to tap along, and the things that other people bring up relate to them, and they get to be participating in something where they're an active participant, but they don't necessarily have to be telling the story and the details. And EFT has a lot of techniques where you don't actually have to share the explicit details out loud of something, and we can still tap on it. We can still work through, the peaks and the events and that, without you sharing it. If you feel like it's something you don't want other people to know, you can work with a trained practitioner. There's ways to do that, so you don't have to like relive or tell everyone about this traumatic thing that happened to you. And I think that's important for people to know, because a lot of times, like you mentioned the ACE study, and a lot of times there's traumatic experiences involved that set the stage for chronic symptoms and, trauma that's not resolved. And knowing that you don't have to tell everyone I have to tell everyone exactly what happened, because the practitioner needs to know, okay, these are the specific details. It's actually not like that. So there's a lot you can do with tapping, because you know what happened. So your brain is going to be, you don't have to be speaking about all the details. You're still going to be tapping on the event and how it got wired into your brain and body. So very
It's actually such a good point. Yeah, we have as trained practitioners, we have 48 tools to approach anything that the client comes with. And that what you mentioned, the movie technique or the silent movie technique. So yes, I'm so glad you mentioned that, because yes, you don't even have to talk out loud. If it's something so private that you just want to keep it in the privacy of your own mind, but you can work with a trained practitioner through that incident, whatever it is, inside of the privacy of your own mind. Like you haven't said, what's happening, the event, and you can tap on it and you can get incredible transformation, where you can actually then think about that event without being distressed.
Mm-hmm.
And that's what EFT does. It works, helps you to look at those memories that trigger you, that upset you, and helps you to release the intensity around those memories. So if there is the adverse childhood experiences studies show that there's certain events in the childhood, it could include even sexual abuse,
Mm-hmm.
that create toxic stress through the years, and then create the chronic pain or other issues. So, with the tapping, you can actually, and then you don't want to, you're triggered by those, you might be triggered by those events. You might have nightmares that might turn into a post-traumatic stress disorder, and then keep causing that chronic pain. But you don't know how to deal with that. With EFT can help you to actually remove the intensity around those events, whatever it was, the shame, the fear, the embarrassment, whatever it was. So then you can think about those events, but do not get stressed about them. And if those events once again cause the chronic pain, you can actually stop that vicious cycle.
Beautiful. Yeah.
Yeah.
Is there anything else for people who are curious about working with pain or chronic pain and tapping that you want to make sure they're aware of?
Look, what I say is give it a try.
Mm-hmm.
Give it a try. There is, as we mentioned, there's scientific research that shows that helps. There are case studies that show that help. It's good also to work, my help to work with a practitioner who worked through their chronic pain or other health issues.
Mm-hmm.
That might also help. I'll just mention this case quickly.
Yeah.
About people being skeptical about EFT. And I had a client who rang me one day, and she said that her partner is in Asia, in one of the Asian countries. This happened a while ago, and he's experiencing symptoms of flu and maybe COVID, and he was getting very scared, that he might not be able to come back to Australia, catch a flight in 2 days to come back to Australia. And she said, do you want to work with him? And this person would have never actually come to work with EFT. They were skeptical. They did not believe in any of the alternative things, but because they were like a reached rock bottom, so to speak, they were in a pretty dramatic situation, the way they perceived it. They were open to actually have a session via Zoom from overseas, and we worked for 40 minutes the first day, and then the second day we worked about 20 minutes, and the symptoms decreased, and by the time he was supposed to take the flight, the symptoms completely disappeared. So that person now, he was amazed. He was like, oh, wow, it actually works, But he would most probably not have ever come to work with an EFT practitioner if he didn't have to. So give yourself a chance. There's nothing to lose. There's lots to gain. You can work with the practitioner individually. You can work with the practitioner in group sessions. I will be creating another group via Zoom, which focuses on pain issues and the other practitioners. So try it.
Yeah, thanks so much. We'll have some links down below for how to get in touch, and if you want to work one-on-one or in one of those groups. And thank you for listening. If you have any questions or comments, just leave them below and might be able to follow up with that. And yeah, definitely give this a try, explore it. And definitely, if you feel like you've tried it, like maybe you've tapped with some videos or you've tried to just sort of tap on your own and use positive affirmations and it wasn't really doing much for you, I hope now you have another context of how you might try it differently and to not give up, not give up on the idea of this being a powerful technique. Because I've talked to people in that situation, right? I tried it, didn't work, but what you've tried might be very different than what we've kind of discussed today. So even if you feel like I'm not sure it works for me, give it a try with this particular approach or working with a practitioner where you're really going through it in this way, as opposed to, like I said, tapping will never hurt you, but it's a different experience and you're working on a different level than if you watch a video like on my channel has a lot of videos. It's not the same. So definitely, just open yourself up to exploring different ways of approaching this. And I think it's important to just have that attitude somewhere in the back of your mind that even if something didn't work in the past, or you feel like you've tried things and haven't had much success, that's itself something you can tap on. This fear that nothing works for me or works for other people, it won't work for me. You can use tapping to help process through that stuff, because I know that's a common experience. So even if you have some of that skepticism and doubt, as Celina was saying, tapping can actually help you with that skepticism and doubt. So you don't have to jump into your first session being like, I have to believe it's going to work and be great. Like you can come in exactly as you are, exactly with what you're feeling, including like, yeah, I'm skeptical of this. And a practitioner will be able to work with you right in the throes of that as well.
Great.
Mhm.
Yeah, great point. You can actually work on your resistance on working with EFT. We have tools for many things. Yeah.
Well, thank you so much, Celina. Thanks for this
Thanks,
conversation.
Evan. Thank you. I
And
love talking with you. I love your wisdom and
oh,
yeah, and
likewise.
contribution.
Yeah, great.
Beautiful. Bye
Thanks
for
for
now.
listening. Have a great rest of your day. Take care.
Bye.